It's Friday, October 8th, and the time for your Barbados Today morning news update. Corporate Barbados condemns calls to boycott businesses that mandate the COVID-19 vaccine for their workers. In fact, President of the Barbados Employers Confederation, Sheena Mears-Granville, on Thursday sought to defend the actions of those businesses, suggesting they were not seeking to harm but to heal. The BEC spokesperson further argued that it is not in the interests of any business to do anything which would cause them to lose staff, money, or customers.
The business community's intention is not to create a divide in Barbados. And while I know the debate on vaccine requirements has been raging over the past few weeks, at the core of the matter is an attempt by businesses to keep their workers safe.
President of the Barbados Chamber of Commerce and Industry, Anthony Branca, also weighed in on calls for a boycott.
I think there is a legal process that can be had, and I think that what we should be doing is allowing the legal process to take its course, if that is the route that persons want to take. But at this point in time, I do not support a call for boycotting of any business at this point in time.
Medical officials say the handling of deceased COVID-19 patients, including closed caskets at funerals, is in line with strict infection and control prevention. Grieving families have been publicly lamenting their inability to be involved in the handling of the bodies of family and friends or even view them during the final send-off. At a COVID-19 update held on Thursday, Acting Chief Medical Officer Dr. Anton Best acknowledged that it is a difficult but unavoidable process that is intended to protect all concerned.
COVID, you're still infectious when you're dead, and we want to protect the death care workers. So the standard procedures of infection prevention and control, wearing PPE, apply. What also applies to the management of a dead body is that autopsies are not done if the person has definitely died from COVID. The reason why autopsy is not done is because you may do something called aerosol generation, where you get the COVID-19 particles or virus particles in the air, and then that puts the death care workers at risk. So that's the most important thing that persons should appreciate.
Dr. Adana Grandison, who is a consultant manager of home quarantine and also a vice president of the Barbados Association of Medical Practitioners, stressed that public health measures must be observed even to the point of the burial.
The public health measures for infectious diseases is observed. So we try to ensure that even at the point of burial, that an open casket is not allowed, because then you have persons who are there in the space with their body who can potentially become infected, and we don't want that. So essentially we try to expedite those cases to get them buried as quickly and as safely as possible. But we do understand that family members do need closure, and so we try to accommodate as much as possible, but certainly not an open casket, because we cannot expose our death care workers and we do not want to expose family members.
The United Nations Conference on Trade and Development came to a close on Thursday, with a timeline being set on a range of issues. UNCTAD President, Prime Minister Mia Mottley, and Secretary General of UNCTAD, Rebecca Greenspan, gave the commitment during the closing press conference of UNCTAD 15. Mottley said that the key issues that were high on the agenda to be addressed related to trade and logistics, investment, the creative industries, and climate change.
These things, in addition to the modalities discussed with Secretary General Greenspan, namely the potential of 3 meetings that will focus on 1, trade, logistics, and transport in particular, and the costs of transport, increasing the cost of goods and cost of living for our ordinary citizens. We see this as the most important initial forum that we need to have next year, so that we can begin to deconstruct why our people across the world are facing extraordinarily high high increases in the cost of movement of goods across the global community. The second one will focus on investment, and the third one will be on the new area of creative industries, which is so important to our small island developing states, but particularly our Caribbean civilization, that allows us to be able to plot our way forward.
There's regional and international news after this short break.
Barbados Today, news you can trust.
The newsroom of the region, the Antigua and Barbuda government is taking steps to fully reopen its economy. The details of that story in this report from ABS News.
We want to be in a position to have the country fully open for commerce without regard to these restrictive measures that we have had to put in place these last 20 months. And so within 90 days, we believe that we will be in a position to have the economy fully opened.
Cabinet says this target is based on the continued rise in the number of people getting vaccinated. In the meantime, the curfew hours will be relaxed commencing October 15, while other restrictions have also been eased.
From the 15th of October, from 11 p.m. to 5 a.m. daily, the new curfew conditions will apply. Effective immediately, churches are permitted to host regular worship services based on the previously approved capacity by the Central Board of Health.
Citizens and residents will have more time at the beach as of Friday, with Minister Nicholas adding these new protocols will likely apply during upcoming holidays.
All of the beaches are reopened between the hours of 5 a.m. to 7 p.m. daily, and that will include the weekends.
Some recently closed businesses will also commence operations in coming days.
Also effective on the 15th of October, casinos, cinemas, gymnasiums, restaurants, operators of commercial sea vessels or seacraft are permitted to reopen for services to the public on the condition that the operators and patrons are vaccinated.
And finally, the World Health Organization has launched the strategy to achieve global COVID-19 vaccination by mid-2022. WHO Director General Dr. Tedros Adhanom Ghebreyesus made the announcement.
Today, WHO is launching the strategy to achieve global COVID-19 vaccination by mid-2022. The strategy outlines the road we must all take together to achieve our targets of vaccinating 40% of the population of every country by the end of this year and 70% by the middle of next year. Achieving these targets will require at least 11 billion vaccine doses. This is not a supply problem. It is an allocation problem. We call on countries with high vaccine coverage to swap delivery schedules with COVAX and Abbott and to fulfill their dose-sharing pledge immediately. We call on vaccine-producing countries to allow free cross-border flow of finished vaccines and raw materials and to enable sharing of know-how, technology, and licenses. We call on vaccine manufacturers to prioritize and fulfill contracts with COVAX and Abbott as a matter of urgency.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.